Welcome to the McMaster Children's Hospital Pediatric Medicine Unit. This video will demonstrate our unit's family-centered rounding process. Family-centered rounds allows the healthcare team to routinely meet with the patient and their family to determine their goals and to review how the patient is doing. Together, the patient, family, and healthcare team will identify concerns and create a plan of care for the day. These rounds will take place on weekday mornings. Rounding together creates an opportunity for the patient and family to ask questions and voice their concerns. If you have questions that involve a great deal of discussion, the staff physician may ask that the conversation be continued later in the day. This helps to ensure that they can offer you as much time as needed to address your concerns and that rounds are not delayed for other patients. This is a teaching hospital, which helps to train future healthcare providers. Because of this, you will notice that our team can be very large.
I'm Dr. Federici, I'm the staff pediatrician.
I'm Mike, nurse practitioner.
My name is Michael, I'm a medical student.
It includes medical students, residents, your nurse, a nurse practitioner, the pharmacist, and your attending physician. Other learners and allied health team members who are active in your care may also join in. This allows us to review valuable information from multiple perspectives of care and also strengthens communication between team members and the family. As a teaching center, you may notice that during rounds, a physician or a team member may take the opportunity to ask learners questions or to share information on managing illnesses. Some families find the rounding process overwhelming for themselves or for the patient.
So we're going to be doing family-based rounds and just wondering if you'd like to be in the room or outside of the room with us.
She's actually just resting right now, so maybe if we did it out here?
Perfect.
Great.
Yep. Okay.
For patients who are distressed by rounds, family members may choose to meet with the healthcare team outside of the room. Other families enjoy taking part but may not be able to attend for a variety of reasons, such as sleeping after a difficult night or due to factors related to work and home schedules. An update from the healthcare provider later in the day may be preferable in these situations. When at all possible, the attending physician may strive to meet with you at a later time as well. Whichever option you feel is best for you and your family is entirely accepted by the healthcare team and can be changed at any time. Please let us know your preference by speaking with your nurse or another member of the healthcare team. When patient discussion begins, a member of the medical team or the nurse practitioner will give a brief description of why the patient is in hospital and what active issues have been identified so far. Please keep in mind that this list of issues is a starting point and may change after all information is shared. Next, the nurse will run through their concerns, which may include information you have brought to their attention prior to rounds. Then, either the nurse or our pharmacist will discuss the medications the patient is receiving.
Right now, naproxen is on hold still. The polysporin we're applying to incision every morning. On Danzatron, we're giving just one more dose this afternoon through the IV.
The team member who began the discussion will then add additional information if necessary and discuss which tests or blood work are planned and share the results that are available. They will then suggest a plan of care based on the information presented. This plan may be modified with input from yourself or other suggestions from the healthcare team. As information is provided by the healthcare team, you may hear medical terms that you are unfamiliar with. Please feel free to ask what they mean at any time so that you have a better understanding of the information being shared. In addition, a comment from a healthcare provider may trigger you to clarify information or offer a recent update if something has changed. You know your child best, which makes your participation so valuable to the decisions that are made. At the end of rounds, a senior member of the healthcare team will ask if anyone has any further questions and then summarize the plan of care to ensure that everyone understands and is in agreement. Some families find it difficult to think of questions that they have once the team arrives. You may find it helpful to write down questions as you think of them prior to rounds. The message we hope to share with each patient and family is that you are valuable members of our team. Our goal is to provide the best possible care for our patients and we recognize that this is only achievable when we truly understand the concerns and goals of our patients and their family.
From the entire team on the Pediatric Medicine Unit at McMaster Children's Hospital, we thank you for viewing this video, and we look forward to providing you with family-centered care. Woo!